diabetic eye disease, I'm going to talk about diabetic retinopathy mainly. Diabetic eye disease are common. The common diabetic eye diseases are diabetic retinopathy. This is the most common form of diabetic complications on the eye. It's affecting the retina that the things after this may lead to vision loss if not properly treated. Cataract is also another eye disease. Mainly the change here affects the lenses, leading to cloudy lens that will also interfere with normal vision. Glaucoma is another diabetic eye complication or another eye disease that increases among diabetic patients. In glaucoma, the pressure in the eye increases, leading to damage to the retina and the optic nerve. In this, we are going to concentrate more about diabetic retinopathy. Diabetic retinopathy is the most common diabetic eye disease, as we discussed previously. About 95 million diabetics around the world are affected with diabetic retinopathy. A part of them are threatened with severe forms of diabetic retinopathy that could lead to vision loss. Diabetic retinopathy is said to be the most cause or the most leading cause for blindness in American adults. Okay, let us, before discussing the diabetic retinopathy, we are going to see what is a normal retina. Okay, this is a normal retina. Here, this is a lens, the pupil, the retina in the back layer here outside. The retina, these are the vessels, blood vessels of the retina. This is the optic nerve, and this is here the retina. Another photo for the normal retina, here appearing the optic nerve. This is the retina, these are the blood vessels, and this area, dense area here, is called the macula, and this is the area or the center of vision. Okay, the change, how it's happened, and how it's triggered. In diabetic patients, hyperglycemia is the key factor, or the main factor leading to the development of diabetic retinopathy that leads to a vascular change in the retina causing leakage or occlusion. These are a form of diabetic eye with change seen in the retina if compared to the previous picture of the normal retina. Here, a lot of change that including leakage, bleeding, and new vessels we will discuss briefly on the following. Here, the deposits as a result of the leakage deposit in the retina are called the exudates. Here are the early deposits in the retina. At this stage, a medical terminology called non-proliferative diabetic retinopathy represents the early stage of the diabetic retinopathy. And here you can see also an aneurysms, bleeding or hemorrhage, and the main feature is that exudate is distributed in the retina. This is a picture seen with eye examination or dilated fundus examination. Occlusion is another part, as discussed on the physiology of or the development of the diabetic retinopathy, and the occlusion triggers the retina to produce a new vessels. Once a blood vessel is occluded, then the retina tries to deliver a normal amount of blood by creating a new vessel. These new vessels could be seen here. These are new vessels, as not the normal new vessels. The problem here in the new vessels are that they may further bleed, causing more bleeding and more damage. At this stage, the new vessels are considered a severe form called proliferative diabetic retinopathy. In proliferative diabetic retinopathy, there are two options. Vessels may bleed, causing hemorrhage in the globe, called vitreous hemorrhage. This is what we know as vitreous hemorrhage. This is a globe, this is vitreous. The media filling this cavity is called vitreous hemorrhage. The bleeding in the vitreous called vitreous hemorrhage. This is an emergency eye condition that requires an urgent treatment to prevent vision loss. The other possibility here is detachment or separation of the retina from its base, or known as retinal detachment. As we can see here, this is the retina detached from its base. This is the second option if not well treated, the proliferative diabetic stage, if not well treated, which either on this or that or combination. At this stage, the treatment will be hard and inevitable. Vision loss might occur. Okay. What are factors leading to development of diabetic retinopathy or worsen? Many factors besides diabetic are there. The diabetic duration. As long as you have diabetes, you are at more risk to develop diabetic retinopathy, especially if it was poorly controlled. Hypertension is another risk for diabetes retinopathy, in addition to the lipid disorder or dyslipidemia. Independent risk is smoking for diabetic retinopathy development or worsening. Diagnosis and what is needed. Regular periodic examination, dilated eye exam for diabetic patients is a key screening feature. For type 1 diabetic persons, it's suggested that after 5 years of the diagnosis, they should go through the dilated eye exam. While for type 2 diabetes, it's recommended that initially from the diagnosis to be screened, and then according to the findings to be scheduled for the next follow-up. In case of early or non-diabetic retinopathy, the frequency of the screening could be, or the frequency of the dilated eye exam could be 1 to 2 years. But if any presence, it may frequent according to the ophthalmologist. Once any present feature of diabetic eye disease, ophthalmologists may request further tests for further evaluation. What are the options for the treatment? The established diabetic retinopathy. I'll discuss about early stages that follow up and regular follow-up. Later stages are special conditions known as macular edema need further treatment. Either laser therapy through photocoagulation, this is either focal or pan-retinal photocoagulation, or injecting a specific agent called anti-VEGF or anti-vascular endothelial growth factor. The vascular endothelial growth factor are triggering the growth of the new vessels. So we will discuss the photocoagulation. This applied laser through the retina, you can see this will seal the blood leakage, so stop the growing and stop the bleeding around the retina to preserve the retina and the macula and the area of vision. The anti-VEGF or anti-vascular endothelial growth factor is injected inside the globe or in the vitreous. This will reduce the vascular endothelial growth, which trigger the new vessels development. How to prevent delay of the progression? The main are good adherence to management, applying appropriate lifestyle, controlling the diabetes, controlling the hypertension, and committing to regular visits at especially scheduled by the diabetic team, including the early screening and the ophthalmologist referral. This could prevent, detect early, or delay, or even could preserve vision in late stages once detected early enough. Thank you.